Hello, good evening, everybody. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Skin barrier boosting to maintain and improve skin health is essential in skin care routine. There are times one may face several doubts while choosing the right product for skin care routine. One may carry many myths regarding skincare and skin health, and sometimes it may remain unaddressed, amongst which misuse of topical steroid from over-the-counter preparations is a major one. Misuse of topical steroids is a widespread phenomenon among young people in India, especially women, in which usage of online and over-the-counter medicines contributes largely. Viewers, as you know, many people are using cosmetic products, mostly fairness creams, without even knowing that products contain steroids and assuming that they will get fairer and will have a glowing skin. But they do not know that inappropriate use of steroids may cause several side effects. The practice is associated with significant adverse effects and poor awareness of these effects among the general public. To keep you informed, today we are here to know about essential skin care with skin barrier boosting and awareness of misuse of topical steroids from skin expert. So let's connect today with our skin expert, Dr. Jenny Methew, live from Calicut. Dr. Jenny is a consultant in clinical and cosmetic dermatology at Lisa Skin Clinic, Calicut. Dr. Jenny did her medical training from Government Medical College, Calicut. In addition, she is trained in lasers and cosmetic dermatology from various centers in India and abroad. A member of the Hair Research Society of India, her special interests are in the field of cosmetic dermatology, trichology, and pediatric dermatology. Today, Dr. Jenny will speak on essential skin care for skin barrier boosting to maintain and improve skin health. A very warm welcome to you, Dr. Jenny.
Thank you.
It's a pleasure to have you, Dr. Jenny Methew, with us. And today, as we are going to discuss about, the essential skin care for skin barrier boosting to maintain and improve skin health. First of all, I would like to ask you, what are the myths of urban skin care in the time of formulation of, specialty cosmeceuticals?
Skin care actually is now a very popular terminology. So along with that, we have a lot of myths. Some of them are carried over generation and some are like the newer myths, which you get from the internet and also from the social media. So one common thing is you have to use a lot of products at one time to get a glowing skin. That is commonly seen nowadays. So what we find is people come with a lot of allergies, reactions after using a combination of different products. Like they use different modalities to exfoliate. They use the retinol serum, they use the AHA, BHA peels, then they scrub their face and they use lesser sunscreen. All these things, what happens is instead of getting a glowing skin, they end up with having sensitive skin. So actually, the ground rule in any skincare regimen is that don't overdo the process of skincare. So first we need to start with the basics. What is required for you? The basic moisturizer, your sunscreen and a cleanser. And as you get adjusted with these products, you can add on like different products. But it's not necessary to use too many products at one time. The next thing is you have to use a higher concentration of the product to get a better result. And all these ideas are promoted like in the social media, like the higher concentration is better. Like that. But ideally, you have to use the evidence-based concentration, which is proven by research. It's not the higher concentration. Even for vitamins, there is a recommended daily allowance. If you take more, you will have toxicity. The same way, the skin vitamins, it has to be used at a particular concentration. And if overuse can lead to skin irritation and sometimes acneiform eruption. And another important thing is, like sometimes you feel a cream that gives you a faster result is the best one. Like especially in case of many fairness creams, like you'll be really glad when you get a fair skin within a week. So one thing you should be really careful, as you had rightly mentioned, is that the only thing that you can give you instant fairness is like a steroid containing cream. It's going to damage you eventually. So when you take your like skincare products, you need to make sure you select products with long-term safety profile. And another common myth is you have to go all natural. All natural doesn't have any side effect. That is an age-old myth, actually. So you first try all the do-it-yourself remedies, and finally you end up with some irritation and come to the dermatologist. So, one thing you should know is there is all natural. Everything, whether it's a fruit or vegetable, everything has chemicals in it. If it is like a lemon juice, like it is made of an acid. So that raw acid is going to irritate your skin. So we get so many patients coming with irritant dermatitis after using of these kind of products. And even if it is in a jar, you can't make an all natural product. At least you should have some preservatives or some other chemicals to preserve it. So like in the cosmeceuticals, the extracts of these like whatever fruits, with all these extracts are being used at the right concentration. So it's safer to use these products. Another myth is like commonly men, they don't have to use anything, like they just wash their face with a bar soap and they go out in the sun. It's like age, or like we don't have to take care of your skin. Like actually, even for the men, they have these issues. They have thicker skin, they have more oil. That doesn't mean that they don't have to protect their skin. The products may be different, but they have to follow a regimen, at least the minimum one, to maintain the skin health.
Right. I mean, just by answering one question, you have, cleared so many doubts that we all have. And you are so rightly said that, we all these days are guided by either the influencers on the social media or, the marketing gimmick, etc. And we end up buying like 100 products in our daily skincare regime. So definitely, I mean, yeah. So, doctor, how do we select the suitable skincare products? As you have said, multifunctional products, they deliver results or they deliver good results is really not clear. So, we would like to understand what is a basic skincare routine that we all can follow, and how to choose or select the suitable skincare products.
Actually, many of you will be really confused when you go to buy like even a good cleanser, like what suits for my skin, what is my skin type. So many doubts will be there. So basically, when you select a product, there are certain things you need to be careful about. That is, you must be knowing it is selected based on the skin type. But even the skin type is not constant. A person may be having dry skin at one time, and sometimes it can turn oily. Like if you go to a very cold climate, then your skin becomes dry. And sometimes when it is hot and sweaty, your skin becomes more oily. And so the products need to be changed accordingly. And sometimes when you're having some hormonal imbalance or some internal disease like thyroid or diabetes also, your skin can turn dry. So one thing is based on the skin type and the climatic conditions, you may have to change your product. Then like depending on what your skin condition you have, if you're having acne, whether you're having pigmentation, then your skin products will vary. And also if you're having any skin allergies or sensitive skin also, you need to be careful in selecting your products. So basically the basic regimen, it consists of in the morning like three things, like you have to cleanse your face, then you have to moisturize, then followed by the sunscreen. This has to be followed by all age groups. So even choosing a cleanser is a difficult task. It depends on like whether you have dry, oily or sensitive skin. And basically, most of you must be thinking why we should use these cleansers. We can just use a bar soap on your face. That was practiced, years back. Like now only all these new cleansers are introduced. So it has been proven that the bar soap is highly alkaline in nature. So when you use it repeatedly, it strips the oil from inside this the skin barrier. The lipids will be lost. And actually the waterproof barrier becomes permeable to water, and the water enters the skin, and it can cause swelling of the cells, and it can make the skin cells more detached and more dry. The skin will become more dry on repeated use. So when you're using a bar soap repeatedly, like all these things can happen. But if you're having very thick skin, ordinary skin, for some time it may be okay. But long term, there is more chance to develop wrinkles and pigmentation. But those with sensitive skin and dry skin, the skin will react much faster. So when you select a cleanser for a dry skin, it's better to use some hydrating cleanser or a very mild cleanser, which contain added moisturizer. So it leaves a layer of moisture in your skin. It's better to choose either a neutral pH cleanser. And then for oily and acne prone skin, for them, the problem is their skin sometimes is oily, sometimes it goes very dry. So mostly they use harsh cleansers, like they want to degrease their skin. So when they use very harsh cleansers, it becomes very dry. So even oily skin people, they shouldn't use too much degreasing for their skin. They can use added like products like salicylic acid, glycolic acid containing face washes they can use for the skin. And for those with sensitive skin, they have to use products with zero fragrance, then without alcohol, very mild for gentle cleansing. And for those who are having like mature skin or with pigmentation, you can have added like skin brightening cleansers are available. So that's about the cleansing part. So about just washing after washing your face, you have to pat it dry. Never rub your face with the towel. That you need to be careful. But many of the patients, they want very clean, so especially the forehead, certain area, they rub very hard. So they end up getting pigmentation after some time. And never use hot water to wash your face or body because it strips off the moisture from your skin. So that's about cleansing. Then immediately after cleansing, within 3 to 5 minutes, you have to apply the moisturizer on your face. So the moisturizer also, choosing a moisturizer depends on the climate and skin type. If you are having a dry skin, you can use a moisturizer twice daily. If you have oily skin, you can use it at maybe once daily at night. And if you have sensitive skin, you can use it 2 to 3 times a day. And this has to be followed by a sunscreen. And it depends on like the sunscreen you choose. Depends on like whether you're mostly indoors, whether you're outdoors, whether you sweat a lot. All these things will determine. So these are the basic things. And then you have add-ons like different kinds of serum. This is like going an extra mile. The other is the basic things. So like you can add on like antioxidant serums because like the skin in the daytime, it is in a state of protection and prevention from damage. So you can use antioxidant containing serum. The serum has to be added immediately after cleansing. That has to be followed by moisturizing and sunscreen.
Right. So the basic skincare regimen will be like a cleanser, moisturizer, and a sunscreen. These are must, and it depends upon your skin type, upon the conditions you are in, upon whether your skin have any issues or not. But then these are the basics, and then you can go for serum, etc. But doctor, I would also like to know that normally, as you also mentioned, that whenever we have some issues with our skin, we'll first run in our kitchen for some home remedies or some quick fixes, or we'll go to the chemist and ask for some over-the-counter medications. Doctors or a qualified dermatologist comes really late in our list, in our priority list, in case our skin is going through any issue. It's only when the condition worsens that we go to a dermatologist. My question is, can we go to a dermatologist even in seeking advice for choosing the right kind of products for us? Skin care is a regular thing. It's a daily thing. We need to go with the cleanser, the moisturizer, the sunscreen part regularly, daily, and more than once, right? So, is it a good advice to go and consult a dermatologist and ask for their help in choosing the right kind of a product rather than going for home remedies or quick fixes in the chemist shop?
Yes, of course. Now most of the youngsters are getting more and more aware of that because of the social media awareness. Previously, it was very rare, like somebody coming and asking us, Doc, can you tell me about my skin type? What product should I use and all? Now it's becoming more and more common because even if they are using something, they are not sure whether they are doing it right. Because when I question to each and every client, all of them are doing it differently. And they say like, I don't have any result. Or when I ask them, after you cleanse your face, do you feel dry? Then they said, oh yes, we feel dry. So your cleanser should never make you feel dry after cleansing. That's the basic thing when you choose a cleanser. So when a client comes to us, we can examine their skin and we can like see like what blemishes, what issues they have. And also take into account their personal choices, because sunscreen, some people like the gel, some like the lotion, matte, like that. So according to their choice, what is the best for their skin, all those things we can select for them. Otherwise, when you go to the chemist, they'll just give you one product, that's all. And when you go searching in the net, like you just go for the one with the best reviews, like you don't know what it's going to do to your skin.
Exactly. We all are different. Our skins are different, and our requirements and necessities are different. Okay, the basics are same for everybody. We need a cleanser, we need a moisturizer, we need a sunscreen, but then we need a different cleanser, moisturizer, and sunscreen as per our skincare requirements. So please, it's always advisable to go and consult a dermatologist to get the right one. Um, and that's a really good option. We would also like to talk about people who have oily and acne prone skin, doctor, how to maintain it effortlessly. And there are a few more things that I would like to add to this question, like many times people who have acne prone skin, because their skin is most probably oily, now they end up cleansing their face with a cleanser as often as possible, and they say that that will keep my skin oil free and thus acne free. Another query that most of the oily skin people have is, why do I need to use moisturizer, because I have already a very oily skin? Now what's your take on that, and plus how to maintain oily and acne prone skin?
The oily and acne prone, actually, as you said, they have a lot of queries regarding the cleansing, moisturizing, and they don't want to use a sunscreen because they feel it's making the skin more oily. So regarding the cleansing part, like actually you don't have to cleanse your face more than twice a day. Because if you're using the right cleanser, like it can maintain your skin. Like if you're using a very harsh cleanser, what happens is immediately you feel the dryness. So after some time, to compensate, your skin secretes more oil. Then you feel more oily. Then again you feel like cleansing. So if you are using the right cleanser, it can maintain the skin like with less oil for certain time. And if you're using it regularly, it will reduce the oil production also. So if you're traveling outside, you're sweating a lot, then one thing what you can do is you can use some cleansing pads, like micellar water, some content. You can just dab your face, just clean your face. Because even using water several times a day, it's not good for your skin, because you think it's just water. But water actually, when you apply it several times, it strips off the moisture, like the lipid from the skin. So cleansing maximum you can do twice, or at the most, like if you want, you can do once. And always use a mild cleanser. Even if your skin is oily and acne prone, it shouldn't have any harsh surfactant, and avoid like bar soaps on your face. So that is one thing regarding cleansing. And regarding moisturizing, one thing you need to be aware is that the moisture content is different from the oil content of your skin. Mostly people get confused, like my skin is oily, so I don't need to use the moisturizer. Moisture is actually the water content of your skin. So normally a water content is between 20 to 35%. You need that water content in your skin. The other is the liquid content. So even if your skin is oily, that doesn't mean your skin is moisturized. Because of the too much washing, it is likely that it is the moisture content of your skin is less. So for many patients with acne and oily skin, when I ask them, most of them say, yeah, at times it becomes very dry. It is oily, but after some time I feel dry, tight, I don't feel comfortable with my skin. So that dryness and irritation is due to the lack of moisture in the skin. So when you're adding a moisturizer, you're adding moisture into the skin. That water is retained within the skin. Otherwise, when you wash with these cleansers, like the epidermal water loss from the skin will be increased. So when the water content of the skin goes down below 20 or 10%, the skin will start flaking. And the normal shedding of the skin doesn't occur. So your skin will feel like, it's already flaky, dry, irritating. So for acne prone people, they can use oil-free moisturizers. A lot of moisturizers are available, like water-based moisturizers. And even there are some moisturizers which reduces the oil content, which reduces the oil production in the skin. And another important thing about the oily skin people should know is that why they are getting more oil at times. So because of the hormonal changes that is happening within them. So if you are taking more of junk food, fried food, and if you don't sleep and you stress out, all these things can affect the hormonal balance of your body. So naturally, the if certain hormone level goes up, they tend to secrete more oil. It stimulates the oil gland, and the oil, whatever oil is the one which clogs the pores. So the healthy lifestyle is also important for maintaining the healthy skin.
Right. And again, with sunscreen, as you said, there are so many, complaints
Yeah,
people have.
sunscreen, like coming to sunscreen, you can use a gel sunscreen because these acne prone skin is a sensitive skin type. So you have to protect your skin, and even the, or not only the UV light, the blue light, all can lead to more proliferation of the bacteria in the skin. So you can use a oil-free matte sunscreen or gel sunscreen to protect your skin.
Okay. And doctor, we would also like you to shed some light over the use of a scrubber or, about exfoliation of skin, because many times people go for scrubbing like twice or thrice a week because they feel that this will make my skin, flawless, spotless, and even. So, what's it with scrubbing?
Okay. This exfoliation of your skin, it can be done either mechanically with the scrub or with chemical exfoliation. But I personally I prefer the chemical exfoliators. Like the salicylic, glycolic, or lactic acid. The problem with physical exfoliators is you need to be extremely careful when you do a scrubbing, because if you apply little pressure on your skin, it can damage the skin barrier. And the kind of scrub we are using is also important. If you're using fruit pits like apricot scrub, like walnut scrub, all these like are abrasive actually, because they have that tips, it can cause damage when you're using it regularly. So the skin barrier, there is chance that it can get damaged. Then there are others, very light scrubs made of polyethylene and polypropylene beads. They're very mild. If you feel your skin is a bit more oily, maybe you can use it once a week or twice a week. But you need to be extremely careful, because for some people they get breakouts when they do the scrubbing part. And you can't just scrub away the blackheads, because blackheads is the only the top portion, whether the oil is getting oxidized, and when you scrub it, only the top portion is removed. Again, you will get black. After 2-3 days, again it's going to happen. So if you are using a chemical exfoliator like a salicylic acid containing, glycolic acid containing face wash, it will help to clean the pore, and it helps to reduce the formation of the blackheads. And those with sensitive skin and dry skin, it's better not to use a scrub on the face.
Fair enough. Many times there are people whose skin, is not able to tolerate any cosmetic product. How to take care of that?
A sensitive skin type, like what you mentioned, they can't tolerate anything. It's becoming more common nowadays. It can be due to genetic defect, because they don't have the like lipids in their skin, but mostly it is due to over usage of products or steroid containing creams. So in the sensitive skin type, even the skincare regimen is best to be taken with the help of a dermatologist. You have to use the right cleanser, I said, very mild, with no alcohol, no toners, with like they need to moisturize frequently, and those moisturizers which contain barrier repair ingredients will be better. And the sunscreen, it is better to use the mineral sunscreens without the chemical ingredients, because sometimes they don't tolerate these chemical sunscreen. And if you use like certain barrier repair creams for some time, it stands that your skin is going to become less sensitive after some time.
Okay. Then there are people who are, working from home, and even though their sunlight exposure is limited, their skin turns darker and lacks glow. The same happens to many times those women who are mostly inside their kitchen cooking, and their, again, sun exposure is very limited, but they get to see pigmentations, etc. How to take care of photosensitivity, Dr. Jenny?
Actually, for those who are working in, now it became more common after the COVID era. Mostly people are working indoors.
Right.
So they never use the sunscreen because they're not getting exposed to sunlight. But what you should be aware is the blue light to which you are getting exposed. You use glasses to protect your eyes, but you never protect your skin. So when you're getting exposed for hours, like at a stretch, So what happens, it gives rise to increased pigmentation. It's like 3 hours in the blue light is like 1 hour you're like going out in the sun. So naturally you'll get tan. So you have to use a sunscreen with blue light protection. And the same happens to the women who are cooking. They're getting more exposed to the infrared light. So infrared and the visible, that blue light, both are now it's been recognized as more important in causing pigmentation and aging. Because outside you'll be very careful. You will try not to get directly exposed to the sun. You use sunscreen, you use some protection. But inside you never care. Like even when we use our phones for a long time, we're not aware that we are going to get exposed to this light for such a long time. And another thing what we find for those who are working from inside is that because they have that sedentary lifestyle, their like habits, like their like routines are very like irregular, like they sleep very late, they wake up late, they don't exercise. So finally they end up gaining weight and having hormonal imbalances. So all this can also add on to this problem.
Mhm. Right. So it's important to maintain a good lifestyle, a healthy lifestyle, eating right, sleeping right, using the right products. All this contributes, and definitely applying sunscreen is very, very, very essential. Another thing, doctor, effective way to take care of your skin at night. What is the secret to that?
Yeah, the night regimen is like something you need to really pamper your skin, because this is the time when your skin actually regenerates and repairs. Morning, you're in a hurry to go to work and you'll be just maybe sunscreen you'll be applying and you're going. But the evening time, what happens is actually our skin is preparing to repair itself. And the skin barrier permeability, the blood flow, everything is highest during the night time. So whatever products you're using, it's going to get absorbed much better than the morning time. So the same like you're done in the morning, if you apply the makeup, you have to remove it with a makeup remover. And then you have to use the good cleanser. And after that, you can use your serums, like antioxidant serums, or if you're about 30, you can use the retinol serum. Maybe you can start alternate day initially. And this should be followed by a moisturizer or anti-aging cream, which is a little more thicker than what you use in the morning, because if it has more lipid content, the absorption will be more. And one thing you should never ignore is your lips. Like mostly you never think of applying a lip balm when you go to sleep. Your lips is the most sensitive part of your the skin. It doesn't have any protection, doesn't have the sweat gland, sebaceous gland. It's also getting directly exposed to all these things. So you need to have a good nourishing lip balm which corrects the pigmentation and the dryness. And especially if mostly if you're sitting in air condition, if you're sleeping in the air condition, naturally it will get more dry. So you have to use a nourishing lip balm. And if you have any under eye problem like dark circles, you can use an under eye cream also.
Right. Many times people come up and say, like, I had unknowingly used topical steroids, which were present in a fairness cream for some time, and now they are unable to stop it or continue it because of the side effects such as pigmentations or acne, etc. What should they do? Is it reversible?
Of course, it's reversible. And it depends on the time period they have used it. If they have used it for a long time, then they need more time to get back to the original state. Because what happens is your skin gets dependent on this steroid. Like you take alcohol for a long time, you find it difficult to stop it. The same way, the skin needs the steroid. When you stop it, it's getting irritated, you get acne, you get pigmentation, you get tanning. So you will feel like again using it. So at the same time, when we use it, the same problems will continue. So like in these cases, what we do is we have to stop the steroid. And these people are extremely anxious because what they want is an immediate result. That's why they went for these creams. So they're worried like people will see me with my dull skin. That is one side. So they are in extremely anxious state mostly when I see them. So they need a lot of hand holding, but if they are very consistent and follow the treatment regimen, they'll get their original skin back. For that, first I give some barrier repair like creams, give them a good regime, like we have to treat it as sensitive skin. And there are certain creams which can be used in the place of the steroid containing creams. Actually, they don't have the side effects of steroids, but they reduce the irritability, redness of the skin. So gradually with all these multiple products, they'll slowly that redness, irritability will reduce. And we have some certain procedures also which can improve the skin function. So if they're really consistent, they can go back to their original state.
Okay. Now, many times people who are, traveling very frequently or sweat a lot, they also have this question that is cleansing my face several times a day would benefit.
Yeah, those who are traveling, it's better they can have some cleansing pads with them, because if you like sweat and then again you wash it, basically you are hydrating it more. So basic washing 2 times is enough for them, and they can use a little waterproof sunscreen and like water-based moisturizer, waterproof sunscreen, so that it is not lost at the time of sweating.
Right. So you can keep some, pads plus sunscreen is a must. So you can't go away with it. No excuse to skip it. So you need to use
Yeah.
a sunscreen as per your skin type. I'll, in the meanwhile, take few
And they have to
questions.
reapply if they're outdoor. They have to reapply frequently, like every 2 to 3
And
hours.
yes, and as doctor, you have mentioned that, the reapplication, we often hear that, it's very important to choose the right amount of sunscreen. I mean, the amount of sunscreen that you're applying, it's important to take care of the reapplication part. So, as you have mentioned, we would like you to, shed some more light on that, because sunscreen, anyways, is very important.
Yeah. Ideally, there is something called the teaspoon rule. Like you have to use 3 ml, like half a teaspoon on the face, like half a teaspoon for the neck, 1 teaspoon on the hand, and all. But I don't think it is practically how much it's possible, because like then one sunscreen will last just for a few days, and people will find it very difficult to apply so much sunscreen and go
Right.
out. So what I feel is, if you use a higher SPF sunscreen, practically, because for Indian skin you need a minimum SPF of 30. Only like very fair patients, actually they need the 50, or like 30 will be enough. So when you are using 50, at least you will get 30. When you are using it lightly, and when you are using a tinted or different formulation sunscreen with add-on products, so they give an extra protection. So otherwise you can't apply the tinted sunscreen very thick on your face. The
Okay.
application will be more important.
Right. And as we are talking about sunscreen, I'll pick some of the questions that our viewers are asking regarding sunscreen. So one question by Priya Sharma is, what is the best SPF to use?
Yeah, that's what I just shared. SPF 50 will be better, because like if you're using an SPF 30, you have to use it really thick. Like if you have to use a half teaspoon on the face, that is 3 ml to get the SPF 30. So I don't think anybody will be using that. So if you're using SPF 50 and you're using a little thinner layer, you'll get SPF 30. And you have to use the UVA protection factor also. It's like 3 plus or 4 plus is better. And if you have a sunscreen with add-on like infrared blue light protection, it is even best.
Okay. Now, Suman Yadav is asking, what is the difference between physical and chemical sunscreen? And Ananya Singh is asking, what kind of sunscreen is best for sensitive skin?
Okay. Basically the sunscreen has 2 different ingredients. The physical sunscreen means it has ingredients like zinc oxide, titanium dioxide, iron oxide, etc. And they give sun protection. Actually, they forms a layer on your skin, and it scatters the UV light. So it doesn't get bound to the skin protein. So in chemical sunscreen, you're using different chemicals like avobenzone, oxybenzone, different chemical ingredients are there. They actually bind with your skin protein, and when they are exposed to UV light, it is converted to heat. So you feel a heat when you apply the chemical sunscreen. Sometimes people say, I feel like sweating. Like you feel it is hot already, like you are in a hot environment, you feel like sweating more. There is a difference between a chemical and a physical sunscreen. Most of the sunscreen has both of these ingredients, so you can reduce the concentration of the chemical ingredients. So those who are having sensitive skin, sometimes they may be allergic to these chemical ingredients. So the zinc oxide, titanium dioxide, normally they don't cause allergy, because like they are metallic oxides, and they are not getting, they form a coating on top of the skin. So those who have like sensitive skin, they can use this mineral sunscreens.
Okay. Tripti Pandey is here asking, should I use a standalone sunscreen daily if my moisturizer or foundation already contains SPF? Then can I go for that, or we need a standalone sunscreen?
It depends on the SPF of the moisturizer using, because some moisturizer they have an SPF of 30. In that case, you
Mhm.
can use the moisturizer with the sunscreen, but you need to be careful if you're working indoors and if you're getting exposed to blue light. And if the moisturizer doesn't have a blue light protection, you may have to use a sunscreen with that on top of the moisturizer. And regarding the foundation, it has a very less SPF, like 3 or 4. So with that SPF, you will have to use a sunscreen.
Right. Ahana Sharma is asking, don't I need to be in the sun to get the proper amount of vitamin D? Now, again, a very, common question that people ask, that if I use sunscreen, are there chances that I'll miss out on the vitamin D that my body needs?
Okay. Actually, for vitamin D synthesis, you don't have to be out in the sun for so long. Even like you don't have to be outside at 12 o'clock and not. Like even if there's a little sun exposure and you are wearing a sunscreen, that little vitamin the UVB will penetrate your skin. It's not your 100% you're not blocking your UV rays. Even with like SPF more than 50, it is just 97% or 98% is blocked, and you're not applying a sunscreen that thick so that nothing is going to penetrate your skin. Anyway, little UV rays will penetrate. And I would say that UV exposure is enough for vitamin D synthesis. And if you're getting too much sun exposure, the vitamin D will be lost from your skin. So too much sunscreen is also not good. No, too much sun exposure is not good for vitamin D synthesis. And Indians,
Okay.
I think it's basically they're deficient in vitamin. Even when we check the vitamin D levels of many people who are always outdoors, they're very confident that doc, I'm outside, my vitamin D
True
is
that.
normal, and it will be less than 10 when we test. So mostly, I feel they are getting too much exposure to sunlight, and it's not because Indian skin generally it's deficient because we don't go out, get like sun tanned and sunbath, all those things we don't do.
That's true. That's right. Okay. So Prashansha is here asking, if I get a base tan before I go to the beach, then am I less likely to be harmed from the sun? Or what
Yeah.
should one do when they are, in a beach or on a beach vacation?
It's every time you have to use a sunscreen because once you get tan, that doesn't mean again it's not going to produce more damage. Because initially, when you're getting exposed to sunlight, you get tan. After some time, the tan goes. But if you are again and again you're getting exposed to the sunlight, the tan it is very difficult to remove. It's called the persistent pigmentary darkening. So it remains dark like that. And there is the most important danger of the sun exposure is skin cancer. Like if you're getting exposed too much, it can lead to these issues also. So even if you're using a sunscreen, you are likely to get tan. It's not that 100% you will remain tan free. It depends on your skin type. If you are like very fair type 1 skin, you are not getting tan. Other type, Indians are normally type 3, type 4 skin, and they easily get tan, even if they use a sunscreen. The sunscreen is basically to protect your skin from sunburn and the skin cancer when you go out, because that is the basic necessity why you are using a sunscreen. It's not
Right.
necessary that because you use a sunscreen you'll never get tan. You'll get some tan, but it will be lesser than what you'll be getting without a sunscreen. And the incidence of sunburn is much higher when you go without a sunscreen.
Right, fair enough. And Soumya Shukla is here asking, ma'am, does skin problem occurs due to the impurities of blood?
Like impurities of blood, I think it's a vague question. Like our skin has, blood
Maybe
impurity.
she is asking this because many a times, there are so many advertisements on the television or on the social media regarding syrups or, stuffs which can which can purify your blood and thus make your skin glow and flawless. So I'm sure
Actually,
you
you don't have to take anything like that, and you need to be extremely careful when you try anything inside because you don't know what is actually there inside that product.
right.
Like impure, there is nothing called impure blood. But if your lifestyle is very bad, you're taking too much junk food, you don't take the adequate nutrients, then the level of inflammation in your body may increase. the pH of your like blood. Normally it is in the like it should be in the alkaline side. And if you take more vegetable fruits, if your diet is healthy, then it is more on the alkaline. Sometimes it can go a little to the acidic side. So then we are more prone to infection, sometimes skin allergy, like even the immune balance of your body. If it is in the allergic side, you'll get more skin issues. But it is dependent on these things, not because of the blood is impure. And if somebody is advertising, recently one patient came, she took some product to clear her blood or something, and she got an allergic rash on her entire body. Because even many of these chemicals are found to be toxic to the liver. Many of these ingredients, these unknown ingredients you're taking, it may become toxic to your liver or kidney. You don't know what you're taking because it's not like a prescribed product. So when you go to a doctor after you taking this product, even the doctor doesn't know what is in this product. So it is better not to take anything inside, like without knowing, just saying the ad that it's going to give glowing skin. Never take anything inside, and you need to be extremely careful when you try anything on your face.
Very well said. Yes. Don't fall for everything that you see online, etc. Consult a doctor always because it's a big risk. And doctor, many times people say that, I have a very important function to attend in coming weeks. Is it possible to achieve a brighter, clearer skin as soon as possible?
Yeah, this is a very common question I encounter actually, because like you don't have the time, you're just coming back from abroad, or you're coming back after studies, a wedding coming, like and you're expecting too much. My skin is going to clear in 1 week. Like what I have to say is that, if you invest a little time on your skin before that, like you need just 5 minutes to use the rice product, moisturizer, like all these things. If you're doing, it will be easier for the consultant to do something on your face. Otherwise, when you come to us, you will be having some damaged skin, very dry skin. That we won't be able to do anything on it. Even if we do, we will do only something very mild. And finally, you'll end up complaining, oh, this, I didn't have any results. It got wasted and all. So, you should know that there are no shortcuts. Like 1 week is too less a time. But if a person is actually taking care of their skin, they are maintaining it, then it is okay. At least we'll be able to provide them with some result. But my advice is never go for the short-term goals. Don't think every time people think of some event. Yeah, after 2 months I'm having my wedding or my friend's wedding. After that they completely stop everything. That's what I see. The 2 months they're very careful. Their skin is glowing and they're very happy. After that we never see them, and they stop everything. And after 1 year they'll be coming with some other like I had acne, doctor stopped everything like that. Yeah, that shouldn't happen because your skin is something very precious. Like if you can spend a little time, you can maintain the results and remain
healthy. Absolutely. And Dr. Jenny, before we wind up, any take-home message for our viewers?
Like what I would like to inform you is like, when we invest time on everything, we spend most of the time on a job, like everything we spend time. But this is the I think for many is the most neglected thing, like your skin or your face, and many feel guilty, I think, when they take care of their spending time on their skin. So if you do a little thing, like little the way you take care of your skin for a morning and evening, this essential skincare, that is proven to provide the most benefit long term. That it will maintain the health of your skin, it will improve your complexion, and it will prevent even that aging part, the fine lines, wrinkles. So it's not that when somebody says, you're having your fine lines, you're getting dark circle, what happened? Then immediately they come running to us. My face is looking like, ask me and now it is mostly connected to the emotional attributes. You look tired, you look sad. Like, what is there any problem? People will ask you, but you'll be like completely comfortable and you'll be happy. But people will be thinking you're having some great problem. You're looking so tired. So that is also one thing. Your eyes will communicate more. So like little things, you need to take care, and your general health, everything. And stress is something very important. Now I feel everybody is stressed, and they feel like it's the way life has to be. Like whether it's students, like working class, they say, no, doctor, I don't have time. I stress so much, I don't sleep. And that is something the most damaging. That even if you're doing a skincare, right? If you're stressed all the time, all the benefit, it will be, you won't gain the benefit
Yes.
of that. So you need to balance your everything, your life. And at the same time, you need to use the right products and make sure that you don't fall for so much ads promoting unknown ingredient. I've heard like people saying even the ingredient which I haven't heard, and they say, okay, this is supposed to be the best. But then, and in literature, it won't be. There is no mention of such kind of a product. So don't fall for such products just by somebody saying, just try it on your face. You need to be extremely careful. So you can save a lot of money, and you'll have peace of mind. That's what I feel.
It was wonderful talking to you, Dr. Jenny Methew. Thank you so very much for your valuable time.
Thank you. It was a pleasure actually interacting with you.
And it was a very informative session for our viewers as well. And we really look forward for many more such sessions for our viewers with you in coming times.
Thank you.
Thank you. And viewers, thank you for your active participation in today's session. And stay connected, stay beautiful, stay spotless. Thank you. Goodbye.
Bye.